Well, hey guys, welcome back to the Friday Q&A. I hope everyone's week has gone well so far. It's Friday. If you're new here, welcome. My name is Andrea. I am a dermatologist, and I love sharing these fun skincare related Q&As each Friday on my channel. So if that type of content is of interest to you, then stick around, subscribe. I also post lots of fun vlogs of my life that are entertaining, I believe. So I'd love to have you here. But as you can tell from the title and thumbnail of this video, today I'm going to be talking about a condition called polymorphous light eruption, or PMLE. Polymorphous light eruption is a common photosensitive dermatosis or rash that, for the most part, largely affects young adult women in their 20s to 40s, although it can affect men and it can affect children as well. PMLE tends to manifest first in either the spring or summer, usually when the patient takes a vacation for the first time and is exposed to ultraviolet radiation, maybe is wearing a bathing suit, whereas they have been covered up most of the winter in winter clothing, and that is often when the rash will first develop. It, for the most part, remains localized to areas of skin that are exposed to ultraviolet light from the sun, so sun-exposed areas. It will have a tendency, however, to more severely affect areas of the body that normally you cover up that are then exposed to light, say in the summer. So for example, the upper chest is an area that we often cover up with sweaters and turtlenecks during the winter, and then start wearing lighter clothing and expose our upper neck in the beginning of summer, and that would be a classic site for developing this rash. It can also occur on the forearms and rarely the face as well. And the rash varies from individual to individual. It gets its name polymorphous. Polymorphous means many forms, and that name comes about to remind clinicians and dermatologists that the rash can look like many different things. However, in one person, the rash will always look the same. So whatever your polymorphous light eruption rash looks like, it probably looks that way each time you get it. 30 minutes to 1 hour of sun exposure is required to bring out the rash typically, and the rash itself can last anywhere from a few to 7 days, bearing in mind the individual subsequently is avoiding ongoing UV exposure. The rash can range in severity from an itchy rash to a frank, painful, blistering rash. And it's not uncommon for the individual to feel like they have the flu. For many people with polymorphous light eruption, as the summer goes on and they continue to expose themselves to ultraviolet light, their skin sort of starts to harden and develop a little bit of a resistance to the sun, and the severity of their rash and outbreaks decreases. Also, in many people, over time, the rash can just sort of burn out and they can, quote, grow out of their polymorphous light eruption. Particularly, this is often seen for whatever reason in women after menopause. Sometimes the PMLE will go away, and we don't completely understand why. However, in many individuals, polymorphous light eruption will continue to occur year after year. If you have polymorphous light eruption, it is important to understand what causes your disease. There are 3 types of energy or radiation or light that come from the sun that affect the health of the skin for everyone. And those are visible light. Visible light is the light that we see with our eyes, that we appreciate as daylight, that we appreciate as a sunny day versus a cloudy, gray day, depending on how much visible light there is, relative darkness or brightness. How the colors in our environment appear, that is visible light that we detect with our eyes. There's also UVB radiation. UVB radiation burns our skin, damages the DNA in our skin, and can suppress the immune system in our skin. UVA is the other part of sun, and actually the majority of the ultraviolet radiation that comes from the sun is UVA. UVA is not really what burns our skin so much, but actually what penetrates very deeply into our skin and can age the skin, damage collagen, and really affect our immune system. For people suffering from polymorphous light eruption, the overwhelming majority of people who have PMLE, their PMLE rash is brought out by UVA, not UVB, not visible light. Other people with polymorphous light eruption, less commonly so, their rash can actually be brought out by either UVB or visible light, all right? But for the most part, the majority of people with PMLE, it is UVA that brings out their rash, and it is UVA that they are sensitive to and causes problems for them. The biology of why polymorphous light eruption occurs is sort of interesting. It is actually kind of thought to be a type of allergy to an antigen that gets kicked up and revved up in our skin when it's exposed to either visible light, UVB, or UVA in predisposed people. And that type of allergy is called a delayed type hypersensitivity. It is the same type of allergy that people get after they have become sensitized to and subsequently allergic to poison ivy. It's a delayed type hypersensitivity skin allergy. And polymorphous light eruption is kind of similar in that manner. It's interesting because, as I've told you all before, ultraviolet light from the sun largely suppresses the immune system in the skin, but for people with polymorphous light eruption, they seem to have a resistance to the suppressive effects of ultraviolet radiation on the immune system and instead have a very, very robust response to ultraviolet radiation manifest by this disease. And while the disease is debilitating and uncomfortable and painful, one thing that is interesting is that people with polymorphous light eruption seem to have a lower incidence of skin cancer. And that's thought to be due to the fact that in polymorphous light eruption, there is less suppression of the immune system. That suppression of the immune system that normally occurs is what sets the stage for development of skin cancer because it impairs the ability of our immune system to clear out pre-skin cancer cells. So while the rash is debilitating, uncomfortable, and puts you in the house of pain, it seems like people with polymorphous light eruption actually have a lower incidence of skin cancer. Now, whether or not that's because they avoid the sun or because of the biology of their disease, it's not entirely clear, but it is interesting and worth noting. In addition to being itchy and painful, potentially having systemic side effects, polymorphous light eruption has profound effects on quality of life. In fact, a large study of 302 patients with polymorphous light eruption showed that 40% of those patients reported profound emotional distress as a result of their disease. It can be disfiguring, it can be isolating. Here you are going on vacation and you're kind of holed up, you can't enjoy yourself. It really does impact your overall wellness. So it's important to seek evaluation and management for this disease, and it's important to discuss with your treating healthcare provider appropriate treatments so that you can live out your best life and not be plagued by feeling poorly about yourself as a result of this disease. It's also important to see your treating healthcare provider because there are a variety of other skin diseases that look quite a bit like polymorphous light eruption. A skin biopsy, if the rash is present at the time of evaluation, can be helpful in affirming the diagnosis. And there's some blood work that should be done as well because there are a variety of autoimmune diseases that can look quite a bit like polymorphous light eruption, and some simple blood work is needed to rule those out. But once the diagnosis is confirmed, what can be done to treat the disease? Well, as far as treating the rash itself, it's largely going to be treatments aimed at alleviating the symptoms and helping the rash to go away a little bit faster. And those treatments tend to be things like topical steroid creams and ointments that suppress the immune system in the skin and help the rash go away. And they also will help with the itching. Phototherapy with ultraviolet radiation actually can be helpful, sort of to, quote, harden or toughen up the skin to ultraviolet light. This is almost akin to getting allergy shots to build up a tolerance to the allergen. And in the case of polymorphous light eruption, treatment with phototherapy can help to almost build up a tolerance to that photoantigen that gets exposed. It can work in some people, however, in other people, treatment with phototherapy can actually just trigger their disease and exacerbate things for them. But that is an option. There are a variety of systemic medications that might also be prescribed in really, really, really tough cases and really, really debilitating cases as well. But I think the most important thing for people with polymorphous light eruption is prevention, namely through photoprotective behaviors, wearing a broad-brimmed hat, a broad-spectrum sunscreen. The best sunscreens that you can buy in the United States for polymorphous light eruption are those that contain only zinc or titanium dioxide, as these will physically block both visible light, UVB, and UVA, and you really need reliable UVA coverage for the most part in polymorphous light eruption. As I said, for the most part, it tends to be a disease that is brought out by UVA, not UVB. It is also recommended that you choose an SPF of at least 50, and for the most part, while higher SPFs are not necessarily better, it's very difficult to put on sunscreens properly to get to the protection labeled on the bottle, so the higher the better, possibly. Sunscreen alone is not enough to protect from this disease. You also need to wear a broad-brimmed hat. I recommend a face shield with UPF 50 or a tight weave. I have prior videos on UV protective clothing that I encourage you to check out that explain the differences in protective clothing and what to look for in your fabrics. But wearing long sleeves, sun protective cloaks, hats, gloves, a face shield, these are all really, really proactive measures that, in addition to sunscreen, are essential for preventing a flare of your disease. The other thing that is very, very important for you as a sufferer from polymorphous light eruption to understand is that ultraviolet radiation can come through glass. And so you can have, your disease can be brought out just by sitting indoors and by being indoors. I also mentioned that it can be brought out in some people by visible light, so visible light will also come through a window, so you have to be aware of that. I have a prior video also all about glass and protective glass coatings and protective glass films. I will encourage you to also check out that video. I go into detail about it there. But for people with polymorphous light eruption, having UV protective films put on your car windows is prudent. Having UV protective curtains in your home is another great idea. Sunscreens in Europe and Japan and Australia have chemical filters in them that we don't have here in the United States that offer more reliable protection against UVA than our chemical sunscreens here. And if you're confused about chemical versus mineral sunscreens, do watch my prior sunscreen Q&As. But chemical sunscreens here in the United States, their UVA protection starts to decline pretty quickly after putting the sunscreen on. So if you are a sufferer with polymorphous light eruption here in the States, you're buying sunscreens here, stick to mineral exclusive sunscreens, meaning those that have just zinc or titanium dioxide in them. And then lastly, the other thing that you can consider is taking polypodium leucomotus. Be sure and discuss this with your healthcare provider, obviously. But polypodium leucomotus, this is Heliocare, the brand name. I have a whole video on this, by the way. I know I keep plugging my videos to you guys who are watching. You're like, why does she keep saying I have a video, I have a video? But I don't want you to miss any important information that I may not be able to cover in this one. But polypodium leucomotus has been shown to be helpful in people with PMLE to lessen the severity of their symptoms and the severity of their exacerbations when coupled with sunscreen and sun protective behaviors. Okay, so this is not a substitute for the sunscreen. So your focus first and foremost should be on sunscreen and sun protective behavior, being aware of the penetration that comes through the glass and trying to put measures in place to prevent that. But this is something in addition that you also could consider. It's on the expensive side. So before you go pursuing this, definitely make sure you have those behaviors, those other behaviors and those other practices in place, because this is just a fancy frosting on the cake, okay? That you know, it can be helpful, but it is not enough on its own. You have to have those other behaviors in place, and if they're not, and if they are not solid and tied in, this isn't going to do you much good. So don't go investing in this unless you have those other behaviors down solid, all right? But yes, polymorphous light eruption is an incredibly emotionally distressing disease to suffer with. It can be incredibly alienating, cause profound emotional distress. It's very difficult to avoid sun exposure in our day-to-day lives and triggering of this disease. It has profound consequences. Please know you're not alone out there. Do not sell yourself short. Do seek evaluation and management. A dermatologist can be your best ally in this disease and getting you better. We see many patients with this. I see many patients with this disease, and there are rational treatments and things to help you get better. There's no reason to suffer with this and to have it impairing your quality of life and your ability to enjoy your summer with your family on vacation. So I strongly encourage you to pursue care from a dermatologist. And in addition to a dermatologist, because this has such profound effects on the quality of your life, causes quite a bit of emotional distress, don't hesitate to reach out to a counselor or a therapist. It can be very helpful to just kind of talk things out, go over other stressors that may be going on in your life that this is further exacerbating. I happen to be a fan of the site BetterHelp. I've talked about it on here before. It is an online platform where you can get professional counseling, professional help. Just speak to a professional, and they can really help guide you and help you to develop coping strategies for this. It's very affordable. You can do it from the privacy of your own home, from your computer, tablet. You don't have to go outside and drive and expose yourself to more UV light. So you can do it indoors, protected. And so I think it is a good thing to consider if you are suffering with this, not being able to enjoy your summer, trying to get through it. It can really be helpful just to have someone to talk to about it. That goes for any medical illness out there. Don't suffer emotionally alone. Do talk to someone. It's a very important part of your care. But anyways, guys, I hope this video was helpful. I hope if you suffer from polymorphous light eruption, at least as the summer is going on, as can occur, maybe it's getting better. I know it is a terrible thing to have to cope with, so I hope these tips in this video was useful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!